people generally struggle to find quality services tailored specially for patients requiring post hospital discharge support. But a startup now wants to change that. To talk about how rehabilitation is being reimagined in a digital world and how home healthcare is reshaping mental health services, we have with us today Rajinish Menon, founder and CEO, Sukino Healthcare Solutions. Rajesh, good to have you with us today.
Thanks for the opportunity, though, by the way.
My first question to you would be, what is Sukino's business model and how does it work?
Sukino's model is all about providing continuum of care for the patients. When I say patients, I'm talking about patients needing very long-term care management. And typically, these are patients who are suffering from chronic ailments. When I say chronic ailments, I don't mean the blood pressures or the hypertensions of the world. I'm talking more about much more severe chronic diseases like your neurological diseases, your cancer, your cardiovascular diseases, which are unfortunately which are going to take a big toll on them or have taken a big toll on them. So in the long run, they will need an extensive amount of recuperative care. And this is where, as a part of continuum of care, Sukino plays a very big role. If I have to just, since you asked me the model, if I have to just talk about continuum of care, this is where our first primary endeavor is to continue the same treatment plan given by the primary physician when the acute intervention is happening in a hospital. Okay, so we are not, as you know, we are not an acute care hospital. We are more like a post-hospital care, and so we believe in continuing the same treatment protocol. Our endeavor is to ensure that we become the conduit or the trusted advisor of the patient and the patient family, and to that extent play the entire gamut of role, whether it is playing the hospital role, whether it is playing the care management role, whether it is playing the recuperative role, playing the rehabilitative role, playing even the concierge role. And let me explain what concierge is. If somebody has been under care post a particular intervention, and after 3 months, 6 months, if they still are not feeling well, if there is sporadic intervention required, the family just has to call us, and because of our CRM, we are able to identify that person, identify the issue that they faced, and appropriately take them to the same acute care or a different acute care as the patient or the patient family would need, and thereby, provide the very good backend support for them. So the entire model is of continuum of care for chronic ailment patients.
How did you identify the need for continuum healthcare?
Well, multiple factors, to be very honest with you. The primary driver every time it comes to the fact that do you have the same problem and are you facing the same problem? And that's when you start looking out. In my past role, I was in Microsoft. I was heading a few segments out there, and I used to travel extensively world over. And because I was in the technological arm of Microsoft, I was exposed to a lot of domains. And by qualification, I'm a chartered accountant, so that helps me to understand various domains. And I saw how the healthcare domain was playing out in the developed markets, especially the US markets, and how the IT and IT enablement was happening over there. And interestingly, so even before IT, how the post-services model were fantastically developing out, and how we missed that kind of a segment in India. And the marrying of the need came from the fact that I had a personal need at home. The lady at the back, my mom, who passed away 9 months back, was somebody with 9 operations to her credit, and a chronic person who suffered from cardiomyopathy, neuro conditions, ortho, you name it. She had almost everything that she had. And I knew the difficulty as a caregiver, how tough it was to balance your career and also take care of the loved one. And that's when I kind of, if I have to say openly, this is where the Microsoft's your trusted advisor kind of a tagline stuck onto me. I saw the model in US. I had a personal need. And it's a question of bringing all the 3 points together and build the model out. That's how this started.
Right. So how are you different from others in the market, and what are the kind of services which are most in demand?
Sure. See, the market is currently having a lot of players out there in various aspects. It can be related to somebody providing only in home care aspect. Again, in home care, you have multiple small stuff being done by a lot of players. The entry barrier into the service industry is so low that people think it's very easy to get into the business and do something over there. But from a long-term perspective, from a very structured perspective, from a protocolized approach perspective, Hardly there are any few players like Sukino out there. The continuum of care, if you see, I would suspect that there are very few players who play the entire gamut of the roles. For example, I have a continuum care center where I take care of patients at the center, where we provide, it's just like a clinical establishment with all the doctors, the nurses, the caregivers, the therapists. So the entire paraphernalia of service of professionals that you see in a hospital are also available in my center. To that extent, it is a clinical establishment, licensed as a clinical establishment, and more recently, we are also NABH accredited at one of our centers. Okay, so somebody with such deep expertise in the domain, and then providing this care not only in our center but in the home or in the hospital when the patient is admitted, the entire, if I draw a triangle, all the 3 points being covered completely. I think Sukino is one of those very unique players in the market out there.
You said, the entry barriers are low. How are you ensuring quality in terms of, the staff that you employ? And B, what are the cities that you are present in?
Oh, that's a great question. Because in service industry, the make or break is always the quality of services, right? And in any service industry, entry is always, most service industries, the entry is always lower. You can only differentiate by providing superior class of services and have the goodwill stick with you. You can't outmarket, by spending money on marketing, and just because today or tomorrow people will come to know. And this is the last mile delivery of health. Right, you have to take care of the person's outcome in a much better fashion. So taking care of quality starts from hiring good people, qualified people, mostly lateral hires, and continuum training program. Like for example, as I told you, we are mimicking all the facets of a hospital in every way. The entire paraphernalia services that you see in a hospital available with us. And it's very important to know, because we have a clinical medical excellence team within Sukino, a team of 9 people whose job day in and day out is to ensure that the quality of each and every documentation, the quality of each and every care is not only documented but also supervised, and then corrective actions being taken. One of the corrective actions we take is continuous training of our staff, and the training is done based on the NABH protocols. You see, so you see how the linkage has been done. So you have a problem, you identify a problem real time, you identify the staff, you put a corrective and preventive action over there, and your corrective and preventive action is just in line with NABH. All the centers are equipped with the high-class and high-end training classrooms with trainers, and this way we ensure that quality day in and day out is kind of not only maintained but also sustained on a longer period of time. Now, your other questions, where are we present? We are largely present in Bangalore with about 5 to 6 centers, coming up with one more center now. We should have about 7 centers in Bangalore, have in Coimbatore, have in Kochi, just coming up in Trivandrum as well, and then Calicut. So these are the cities as of now where we already have a footprint, which are either operationalized or going to be operational in about a month or so. And apart from this, we'll be getting into Hyderabad and Chennai and Visakhapatnam, because these are the next hotspots that we're looking at.
Right. So you're still largely south-based at the moment. You're not looking at north of India or the
We will definitely look at north. There's a lot of cultural equation also in play. You can't just avoid looking at the fact that culture plays a very huge role in this. We will better get our act right over here completely. Be a name to reckon with in south, and then go with full force into the north. Otherwise, culture can completely eat you up, and I may not be able to do justice to anyone either in the south or in the north. So my forte has been south. Let me completely finalize the model in its every way. Admittedly, we are all infants, as I say, in the larger journey. And I would really want to kind of solidify the position over here and then go north and east and west.
Fair enough. So we hear a lot about the role of technology, stuff like AI. What is the role of technology in something that you are providing?
Oh, huge. And technology is a very all-pervasive technology, all pervasive and available, and if you don't start adopting it, you will be gobbled up by someone else. See, the beauty of technology today is also the fact that customers are demanding it. because it has become so easier. Like you would have probably heard the NVIDIA CEO talk the other day that you don't have to learn coding because coding will be done in your own natural languages, right? Now, which means that today even the end usable apps are also used by a majority of people, both in the senior care, the senior population, and also in the mid-level population. Now, when they start using technology, they start demanding the same usage of technology and the information flow real time. As an example, okay. Now, coming down to the aspects of technology. Of course, AI is playing a very big role. If you look into the data processing capabilities that we have, if you look into the beautiful algorithms that are getting built day in and day out world over, and how the algorithm making the life of our doctors much more simpler than what it was earlier, than the predictable or the preventive apps, as they say, wearables, as if you can, if you place them in under that order. So if you have to really look into technology, there are actually three P's over there. One is preventive, one is participative, and one is in the completely taking care of the patient journey, where in each slot, if you see, whether the preventive, you have all the AR related applications. In the case of participatory care, you have the AR, the augmented realities, and the virtual realities, especially in therapies, playing a very big role, motivating people to start doing more, and that way ensuring that they're able to achieve milestones even more faster. So every way technology is getting embedded now, and that's the beauty of the adoption seen in healthcare is really fantastic at this point in time.
From technology, let us look at another aspect, which is about healthcare regulations.
Yeah.
What are the kind of regulations that you guys face? Have you encountered any regulatory challenge or obstacles when it comes to scaling up?
That's a great question. I just went through an NABH audit about 6 months back, and the assessor actually came and told us, this is a new model. We did actually write up an entire NABH only for a post-hospital care, like a continuum care provider. And then since we are registered under the KPME, the Karnataka Private Medical Establishment Act, we are registered as a clinical establishment as a hospital. It made our life much more easier, right? But if you technically still start seeing it, an out-of-hospital care can either be a nursing home or a hospital, but there's nothing called a continuum care standards over here. So to that extent, whatever standards we put for ourselves, taking the best of standards from US, taking the best of standards from EU, and from of the Asian giants out there, for example, from Japan, in the geriatric care market, how do you bring that into India? So this is how we are a self-monitored, self-regulated kind of a setup at this point in time. However, since we are registered as a hospital, and that is my compulsion, I wanted everything to be done on a proper, appropriate basis. And I also got an NABA certificate for my centers that tells you that it will play a big role, if not now, in future. Although currently it is a bit fuzzy at this point in time, right? But it's pick and choose. You pick all the best ones that's applicable to you and start benchmarking yourselves at that. And that's the only way you can grow and you can mature the industries for the future players to come in.
So in terms of potential partnerships or collaborations, do you have any partnerships? Are there some in the horizon?
Oh, we do. I mean, right from academic institutions where we try to, where we have inculcated our curriculum, the geriatric care curriculum or the continuum care curriculum into the nurses, course. From there to all the way to partnership with some AI manufacturers, AI device manufacturers, where we have taken their devices, embedded their AI into our physiotherapy, devices, and which makes it very easier for people to understand and do their exercises or therapy exercises, yet find out how they're doing it. Is it going to be very beneficial if they do something more? So technology adoption from an AI perspective and partnerships toward that is one angle. Curriculum and participative curriculum for students is another angle. The third angle is into multiple other therapy area and clinical areas. For example, you have a smart meters which will calculate multiple sampling and tell you the reports. That is something that again we are working on with a few startups over here. Every now and then, whenever there is an opportunity to work with startups, my past role was heading the startup division of Microsoft. So given that kind of exposure that I had, I am I get to see a lot of startups in the healthcare domain who are trying to do a few things, and I've incubated a lot of them in my own space out here.
So, if I'm correct, you started your journey in 2015, right?
Right,
Yes.
absolutely correct.
So, you've been through a pandemic. You've been through numerous health challenges. How do you anticipate, the evolving patient needs, and how do you adapt your services?
Well, it's been a fantastic journey, to be very honest with you, and especially the COVID was something, once a century. I've never seen. I mean, on a different note, I've never seen Bangalore as empty as I have seen. Being a healthcare professional, I had a chance to drive in those severe COVID times on the roads, and I could see how they were. Now, the point is, it gave us a lot of learning as to, in such critical times, even a small player like Sukino could make such a big impact, right? And then that shows the responsibilities that companies like us have to play in the larger ecosystem, right? Now, is this model going to stay for the longer run? Definitely. Is it going to morph more and more into evolving patient needs? Perhaps it might be. Would technology play a very big role, and would Sukino start playing a very big role in that? Yes, definitely. So as I see it, the need of the patients today are not just from an acute care perspective, right? Because of the nuclear families that we see out there, because of the demanding needs, because of the fact that most of the people also in certain segments have a good insurance coverage, not the total population, but in the certain segments. They keep demanding and they want newer and better services. Most of them prefer, I mean, when we all go to hospital, the first question that we ask is, when do we get discharged, right? The reason is we just want to get out from there, either go back home. And this is the reason why a company like Sukino can take care of them, because our setting is just like a home. It's like a home away from home and a hospital away from a hospital. So these kind of models will only thrive in future, as I see it.
What would be the cost structure for something like this? I know it would be different across different patient needs, but somewhat of a ballpark figure. And does something like this get covered under insurance?
Yes, this is another great question. So thankfully, the current government has been trying to push the insurance envelope, and I suspect if they, a few months down the line, we might see much bigger announcements. Just about 3 weeks or 4 weeks back, IRD had brought across this particular, resolve, and made it very public that even if you're not part of the cashless ecosystem, you can send an email to a particular ID, and then you can get a cashless benefit added on to your organization, and then pass it on to the public, right? So the point is, insurance is evolving, and it will one day completely cover and engulf us as well. But to answer your question, does insurance cover at this point in time occur? Yes, people do get reimbursements of the insurance, provided they have the policies in place. The home care anyway is covered by insurance, so that's not a problem at all. However, cashless is something that some of them do get, some of them don't get. Again, depends on the star policies that they have, the platinum policies they have. So that's where insurance currently lies across.
And the cost structure?
Okay, that's another good question. So that depends on the ailment, but typically it starts from 1 lakh all the way to 2 lakhs, covering everything. I mean, you cover by 25. You get a nice, beautiful room, with all the patient amenities required, just as you see in a hospital. You have a 24/7 doctor coverage, nursing coverage. You have a 1:1 dedicated caregiver in the room to take care of the individual, both from a hygiene need perspective and also from being a conversationalist. Ultimately, people want to talk to somebody. That's the biggest sad point today that every elder faces today. That included, diet included, 2 types of therapy included. All this put together, typically it comes to about 1/4, 1/5 of the hospital cost. So around 1 lakh to 2 lakhs is the range I give, and that depends again on the extreme chronic condition of the individual.
Right. Last question would be, what are your further expansion plans? How has business been in this fiscal, and projections for the next year?
Business has grown very well, from compared to last time around. All of the units are getting set up. They got set up sometime in the month of January, February. The revenues are just kicking in. So we've grown about 22% from compared to last year. Small growth, if you really ask me, but this year we should have a 170% growth. if I go by the AOP that we have drawn up, because the entire capacity has been installed and the capacity has already been operationalized, as I told you, for the last 2 months in the current fiscal. And the next fiscal, you will see that the kind of a growth kicking in big time. Now, coming down to what your other question was on
The expansion plans.
Yeah,
You did
so
mention
yeah,
that.
good question. So again, right now my focus is to you completely sweat the current assets that I have built across, grow more organically with the current assets in a few more geographies, and start adding more and more therapy layers. We just started the pediatric therapy. We're going to start into mental rehabilitation to take care of psychiatric cases as well. We have started something called hydrotherapy. So we want to, and we also started as I told you, the digital AI therapy. So we want to kind of double down on all these investments now. This next year is going to be more focused organically, but after that there is definitely a plan on some inorganic expansions as well, both from a technology acquisition perspective and also from broadening and growing up the value chain to certain newer levels of operational matters that's coming into the ecosystem.
Great. Thank you so much for speaking to us, Rajinish. I wish you all the best.
Pleasure. Thank you very much for having me on the show. Thank you very much.